Hello, my name is Amy Sturkey. I am a pediatric physical therapist. I'm here with Erica and her son Ilya. And Ilya is 5 months old. He's 1 month premature. And we're talking today about a tongue tie. So on tongue tie, what that is that there is a band of tissue that goes from your tongue down to the floor of your mouth. And when you have a tongue tie, that is thick or short or exceptionally tight between the tongue and the bottom of the mouth. It's right here. And the classic way you test for that is you ask for a child to stick out their tongue. And if they can't stick out their tongue, then it's likely tied. Or if they stick out their tongue and it goes down like that, it's likely again tied. Now, on a tongue tie, what you need to know is that it affects the way a child can eat,
yes,
drink, swallow, later speak, or breastfeed or bottle feed to get that latch, a good latch.
Yes.
What does Ilya have?
So Ilya has both a top lip tie and a tongue tie and a posterior tongue tie. Is that correct? Yeah. So he also has that as well. And so for his specific case, when he is feeding, typically we use a bottle because his latch is not perfect, so to speak. He can't form that seal.
So if that lip is, she's talking about a lip tie. So there is a band of tissue that goes from the center of your upper gums and goes to your upper lip. And when that is, there's a band, everybody has it. When it's tight, it's hard to get that seal.
Exactly. It actually, you'll be able to tell because it causes the upper lip to roll under a little bit instead of forming that seal where the lip, I guess, naturally curves against the bottle nipple in this case.
A piece of tissue that goes from the top of the lip to the gum.
And so we have examined that happens. He actually sees a speech and food therapist who noticed it because I had never seen it before. Or I didn't realize what it was at the time when I would feed him.
Can you get that click?
Yes, and he gets the click from not being able to form the proper suction or proper seal while he's feeding. And so the posterior tongue tie, that causes the base of his tongue not to be able to raise enough to create the suction for the formula or breast milk to go down properly or with enough force. And so that's one of the issues that he experiences on top of having that tongue tie where that band is that connects his tongue to the base of his mouth. So he has just a couple of little issues, and we see that with feeding as well as with using his passy. So when he uses his passy, you can also hear the click. And so even though he's not feeding, and I've been told that when they have a passy, it's not the same sucking motion as feeding, right? Yeah. So even though it's not the same motion, you still hear that click. And he actually struggles to hold a passy in his mouth. And many times we have to help him because of the lack of seal and the lack of suction.
But there's also one at the bottom.
Yes.
At the bottom, he's okay though. This is what they look like.
That is correct. So the bottom, he does not have a lip tie. It's just on the top and it's just at the base of his tongue. So
right. So one of the things they talk about is there's a difference between structure and function. So for little Ilya, he has a tongue tie that's, so that tongue tie can be just at the back of the base of the tongue, or it can go all the way out to the tip of the tongue. So his doesn't go all the way out to the tip of his tongue. It's more in the back.
So it's more in the back, but he does have it kind of going toward the tip of the tongue as well. And we've noticed that his speech therapist actually, because she wanted to check, recorded the inside of his mouth and did some palpitation to feel around for it. And later on went back and watched the video that we took to confirm it. And so she did confirm that he has the top lip tie, as well as that posterior and a little ways up the tongue as well.
So with Ilya, he has both a structural tongue tie, lip tie, and a functional problem with it. So there are some children that have those ties, but have no problems.
Yeah, exactly.
And there's some children that have very mild looking tongue ties and lip ties, but they cause a huge problem. So it's not a one-to-one relationship. So if you see a child and you see a terrible tie, that doesn't mean that they necessarily have to have problems and you need to do something about it. But also if you see something that's mild, it doesn't mean you should totally discount what the parent is telling you. You need to listen. The tongue is really important. It has a lot of movements that it does. One of the things it does is that has that wave-like motion that helps send the food back, which is what you were talking about. That's one of the really critical ones. The tongue goes up to the top of the palate, and that is a really important movement. The other things that it does is the tongue retracts and pulls back. The tongue sticks straight out in the front. It can go out and up. The tongue can go out and down, and it can go off to each side. And that lateralization of the tongue, the ability to go out to the side, helps you be able, when you have food, to send it over to the teeth for you to be able to chew on it. And the other thing the tongue does is it cups. So all those things are really important. And when you have a tongue tie, it makes it so you are less efficient in all of those movements.
Limited, yeah. He is limited in those movements that you mentioned with forcing the food up and back. And so that has in turn led to some speculation about the structure or coordination that's also been mentioned that he may be experiencing while he's eating. So we're taking a look into that too. It has been mentioned that he may be able to have a release, a tongue tie release and a lip tie release. As a matter of fact, I have a nutritionist that I've met with that has mentioned and actually gave me some information on a local dentist who offers releases for kids of all ages, including his age. So that's something that we're looking into as well, because it could very well be that we could do that release and see even better progress with his feeding and maybe even help even more with the vomiting he experiences.
Exactly. And different professionals do this, and you'll have to check with your local area. What I recommend is that you find a therapist that specializes in this, because you can do some stretching of those frena to be able to get them ready for surgery so that surgery goes better afterwards. One of the things they talk about is that you can look at the tongue, especially when children cry, your tongue should go up and forward a little bit, and they have that big scream.
Yes.
Children who have a tongue tie, that tongue will not go up as high. And so it's one of the ways that you can know. Another thing is that it's often you'll see them have an open mouth posture, either slightly or further open. I was a child who was a mouth breather, so I found that kind of interesting too. And you can look at the tongue as well. The tongue on some children who have a tongue tie have a V tongue. So right in the center, it has a little notch that goes in. And then on more extreme cases, you can have what's called a heart-shaped tongue. So it comes out and then, like the end of a heart, kind of bows in significantly toward the center. Does he have either of those?
So that hasn't been discussed specifically.
Have you noticed when he cries, does his tongue go up as high?
It does not. So we have noticed that when he cries, he doesn't get that visual that you gave to us. And so we could see that is one of the ways that we could see that he does have that tongue tie. Yeah.
I think those are all the things I wanted to talk about a tongue tie. I think it's important to find people who are experienced in your area with providing therapy for tongue ties and lip ties, but also finding the right professional. I know that there are therapists here in my area that are very opinionated about which doctors do better tongue ties and corrections. And also you'll need to research in your area who are the best professionals to be able to help you with this. I hope this is helpful, and we'll look forward to seeing you next time. Thanks a lot. Bye-bye. If you liked this video and would like to be notified by email when the next video comes out, click the subscribe button here and click the golden bell icon and ensure notifications are enabled on your account.